know, guys, I call this the butt scrub. It is used for joint tension within the hip, and the idea, just so you can see what I'm trying to do here, it's not a pigeon pose, and I'll show you why. If this is my pelvis, right, if my pelvis opens up, it's really hard to explain, but if this is my big leg bone, my femur coming up into my pelvis, I'm going to try drive laterally so that I open the joint space. And you'll hopefully see and understand this a little bit better, but as I open up that joint space and stretch out the joint capsule a little bit, I create a lot more mobility in the hip. So if you have that anterior hip pain, and you bring the knee up towards your chest, this is going to be a really good one for you. So the difference is I'm not falling into the pigeon pose, right? I'm trying to, I turn my one foot inward, so I'm externally rotating the hip, and then I reach my other foot over and across as best as I can. On the side, I'm reaching this foot over and across, right? And the goal is to find tension right here in my hip. And so what I'll do is I'll lean into the stretch that way. So from the front, I'll lean this way versus falling backwards like a pigeon pose for a piriformis stretch. And the idea is to relax into the position so that I'm not stretching muscle, but I'm actually getting into the joint capsule. So once I'm here, I've leaned, I feel the tension in the hip right through here, right in that spot right there. And as I've leaned, I'm going to start to do these itty bitty little circular motions. And this is why I call it butt scrubbing. And so I'm just going to scrub through the tension of that joint capsule. The tendency is to flare the pelvis away from the pain or to turn inward too much, and then you draw a lot of tension through the fascia of the musculature rather than the joint capsule itself. So get into this position, foot is externally rotated, other foot is reached across, kind of like a pendulum, and I'm going to use that motion with small circular motion to open up that joint space and give myself more relief throughout the hip. And what you'll see, I should have done this beforehand, is if I now go to squat, I'm going to have a ton more room in this hip than I do the untreated side, because I've opened up the hip, and what that does is puts better position for the knee and the ankle to fall into throughout the ranges of motion of the squat. I hope that helps.